Hi, my name is Terry QT, and I am the founder and director of Deep Sea Foundation. Welcome to our educational channel where we talk about a number of topics related to breast cancer and breast reconstruction. I'm very honored this morning to uh, welcome my guest, Sherah Juarez. She is from Ink Boutique in Houston, Texas. Sherah, welcome to the channel this morning.
Thank you so much. Good morning. It's nice to be here. Thank you.
It is nice to see you too. I have to tell you, Sherah, in 2002, our paths may or may not have crossed. I don't know when you started your business. You can tell us all about that. I love Houston. I was down there in 2002 for my first diagnosis, and I spent so much time down at MD Anderson, the University District, the Rice Village. That's where I'd go and have my lunch after chemo or radiation or seeing my oncologist. I think we could have had a little coffee together and chatted.
Absolutely. Absolutely.
Anyway, that's my connection to Houston. But Shira, I want to thank you too. You are a member of the closed Facebook group Deep Sea Journey Breast Reconstruction After Mastectomy. So I publicly want to thank you for being in that group and lending your expertise and support. You're so generous to do that. What I'd like for you to tell us this morning, I'm going to try to get this word out. Tell us what a micropigmentologist is.
I
And
think it took me like 5 years to be able to spell my title.
oh, oh, good, good. Then I'm glad I got it out on the
That
first
was
try.
perfect. You did it perfectly on the first try.
Yeah, tell
So
us what
I
you
am
do.
a medical micropigmentologist. And what that means is that I have gone to school and am certified by the State Department of Health that I just more or less do medical tattoos.
Mhm.
And so that is my specialty. That's kind of my niche here in Houston is the 3D areolas and also the scar and more of the paramedical tattooing.
Mhm. Okay, well, tell us why you got started in this work, because this is a special calling, and I think what I want viewers to know when they come to you, Sherah, you do have this medical training and background. You work with a lot of plastic surgeons. Tell us what breast cancer patients should be asking if they go to a tattoo artist to complete their breast reconstruction journey, to complete um, to kind of close the loop in an after mastectomy surgery, even.
Mhm.
You,
Absolutely. That's a great question because the medical world for tattooing has changed so much in the last 5 years. Even it used to be that when you would go to a medical facility to have these type of medical tattoos formed, we were using different equipment, different pigments. They weren't lasting very long. We really didn't. We didn't really share much knowledge with the traditional tattooist, and that has changed immensely. And so the tools and the pigments that we now use, I feel like it's super important to find out when you're thinking about having a tattoo done at your doctor's office, what kind of pigments are they using? Because we have pigments that are designed for the face that are more of a cosmetic ink, and then we have pigments that are designed for the longevity that are more for the medical side of it. And so because we are tattooing on compromised tissue, sometimes it might be radiated, sometimes maybe it's necrotic. We can't just tattoo that every 2 years over and over and over like we could if we were doing someone's lips or their eyebrows. And so it's very important that they find out if they're using more of a body type ink or if they're using a face type ink. That's probably the simplest way for them to kind of ask their artist. Also find out who's doing the tattoos. The reason that I work for 24 plastic surgeons here in Houston is so many offices are there. The doctors will be performing them, or they'll have a member of their staff performing them. And so it's really important to find out what kind of education the person performing that tattoo has. And so even the doctors are still finding, and learning through this whole curve that, wow, this whole tattoo world has really evolved in the last 5 years. If you even go back and look at my tattoos 5 years ago, they're night and day difference. And so the doctors are now really excited to have artists able to come in, offer safe tattoos, quality tattoos with realism. And so the whole tattoo world and the medical world really have collided into one. And it's just been a beautiful thing.
I have actually seen that too, because I had my deep flap breast reconstruction in 2014, actually in Texas, in the San Antonio area. But I had nipple and areola, I'm sorry, I had skin sparing, nipple sparing mastectomy. So I did not need the nipple and areola area re-tattooed after my breast reconstruction. But via my foundation work and finding people like you, Sherah, has been so rewarding to me to be able to pass this along to patients. You said something this morning, and not only are you doing the nipple and areola tattooing, you're doing the other facial tattoos. Wow, I could have so used you back in 2002 when I lost my eyebrows. I think that reclaiming your beauty after breast cancer is so important. Our bodies are assaulted by this disease in so many ways. But for you to, answer this calling to serve breast cancer patients, it's such a beautiful thing, Sherah. You've given us some really, really valuable information today. I'm going to put the information in the video, but tell us, where can we find you? I mean, if patients are in the Houston area, or I had to travel for my reconstruction. Let's say they're traveling down to the Houston area. Tell us where they can find you and how they get a hold of you.
Yes, absolutely. Thank you so much. I feel truly blessed to be a part of this industry and to be able to help the women with the brows or with their breasts or just with esteem in general. It's been an honor, and I truly am so thankful for my profession. I would love to help anyone that's willing to come this way. So I am in Houston. My website is inkboutiquehouston.com. My cell phone number, you can reach me at 713-232-0827. And if you're not in the Houston area, I have worked with advanced artists from all over the world. I've worked with women in Jordan, women from Canada, women all over the US that I've trained with that are phenomenal artists. And so if you're looking for someone that you can trust and that understands all the ins and outs on working on compromised tissue, you're more than welcome to reach out, and I'll help you find an artist as well. So I'm happy to help in any way that I can.
Well, thank you so much for this interview this morning. I can tell just by talking to you, although we've never met, I think our coffee would have been delicious, warm, and welcoming. I can tell you have a very special heart for breast cancer patients. What I would like for the viewers to do, if you have any questions or comments on this video or others, and you have ideas that you would like for us to share on the YouTube or on the channel, please let us know. Sherah, thank you again so much for joining us today. Thank you for and thank you for the work you're doing. Really appreciate it.
Thank you. Happy weekend, ladies. It was so nice visiting with all of you.
You too, Sherah, and stay safe. We're filming this during the pandemic, but
it's crazy, scary times we live in.
It is, but you're staying safe. Your patients are staying safe, and so that's all good, and still being able to provide this service, and that's what I like to hear. Thanks again for joining us.
Thank you.
Uh-huh.